So I want to thank all my speakers for sticking to the time. That was great. Do any of you have some questions you want to raise among yourselves?
Actually, I had
Beata?
one. Yeah, so I'm really grateful that you mentioned that people don't stay in place.
Yeah.
And that when models become complexer, they may actually make more mistakes than when you're using simpler models, because my little slice model from the early 90s worked really well, and I think partially because I allowed women to move around in those areas and pick from the air, and I got an average level at the monitoring station. So unless we can put a monitor on every single person and do that for 500,000 people, we will have measurement error. And these very fine prediction models will have a lot of measurement error. And we actually saw it in the study where we interviewed women. When we split the cohort into two, the women who stayed home during pregnancy and the ones who went to work, the model worked really well in the ones who stayed at home and not in the ones who went to work. Right. For health outcomes. So the health outcome predictions went down.
Yeah, I think what's driven us in this direction is the need to generate research about the relationship of ultrafines in particular with health measures. And if you stick with NO2 or something like that, you can do that, and that works pretty well. It's not so easy to do with ultrafines. And so, to our knowledge, there are no reported studies of chronic exposure of ultrafines with any health measures so far. I'd be happy to be corrected if there are any, but we don't think there are any, at least that we've seen published. So that's really been the sort of the motivating and driving force, but it led us down this path that got us into the quagmire that you're describing. Yes, thank you.
Jim?
Yeah, I have a question for Dr. Pereira about the BAP DNA adduct. You've been, I think, very successful in using that in a number of studies, and from biological plausibility standpoint, it's good, internal dose, that kind of thing. But still, I think the question remains that whether you observe the facts as really that's the BAP or PAH, or is really the mixture, with the sources that really come up with many other things that you are just measuring in one compound. So do you have any comments?
Well, the adduct we're measuring, initially we used an immunoassay, an antibody that did capture not only benzpyrene but other structurally similar PAH. The method we use now is specific to benzoapyrene, so the tetrol specifically to BAP. And yet you make the point that benzpyrene is correlated with many other of the PAHs, and quite highly so. And that's why it's often been used as a representative PAH. It's the most studied, it's sort of the classic representative PAH, but it could be representing other PAHs. In our air monitoring measure, it's the sum of 8 PAHs that are commonly monitored in studies. It's the same 8, and it's the sum of the concentrations both measured on the filter and in the polyurethane filters, which is so vapor phase and particulate phase. So we know we're specifically measuring benzpyrene, but riding along with that may be all these other PAH.
So I'm actually going to follow up on that with a question, Ricky. Mm-hmm. So we heard this morning a lot about the complex mixture of PAHs and the petrogenic PAHs, the hydroxys, the nitros, et cetera. Mm-hmm. Are you looking at any of those, or do you think your BP adduct is going to give you some kind of integrated measure that would include those?
Yeah, right now, no, we are not looking at the nitro or oxo PAHs, so we can't infer I don't believe we can infer their concentrations from the measurements we have.
Okay, Jim, or no, Doug, you had a question.
I had a question for you, Jim. I just couldn't help but notice that your biomarkers are totally different than mine. I wondered if you could comment on why you chose the ones that you focused on and what you think their strength is?
Sure. I think we have, thought a lot through the selection process. I think it was the study was designed to test that hypothesized mechanism that put out by the American Heart Association. What's the Heart Association, right? Then that we really think that we didn't do. I think you did a CRP. We do CRP as well. We didn't get good measurements because we did it in China. The clinical collaborators think high sensitivity, which is clinically high sensitivity, which actually half of the data come out to be non-detectable. And then we measured this P-selectin, which is actually shown up very nicely for the platelet activation, which support that the hypothesis that PM will really induce the will activate the platelets, and that's a precursor for coagulation, and that downstream will translate into this MI, that sort of thing. And then as you can see, we really didn't see much in those young people, the heart rate variability that's weighted for biomarkers, which many people actually reported in lots of studies. But if you look at those studies come out at Harvard, George Schwartz did lots of those things, but those are elderly, whatever. So that didn't. And the oxidative stress biomarkers, I think I was using 8-OH hydroxydeoxyguanosine, and also use malondialdehyde, 8-isoprostane, and those things, because I have a HPLC-based method. They measure more specifically than the immunoassays you sort of, sometimes give you. So anyway, we were very, I think, quite lucky to see those biomarkers actually show up cleanly related to things that supported the biology. So.
Okay, I think we've got a bunch of cards with questions, so I think we'll turn to them, and obviously may lead to, I've got one for each of you individually and a couple in general. So just happens, Beata, that the one for you is on the top. This actually came in from the webinar, so that's nice. All you people on the webinar, we're glad you're there. Your Gaussian plume model is normally used for stable pollution source, so can you explain how it was used for the line source model?
The Caline model?
Yeah.
I'm not the person to explain Caline, but what I understand is that a lot of meteorology as well as emission factors goes into the model, as well as road geometry and wind speed, etc.
Okay.
And that's how it's used. And so, and traffic, the traffic density goes also in. They put a lot of different variables into this model. What I was most concerned with was the emissions profiles that they put in, because all the toxicology, or the exposure measurement people around me kept saying, well, they're only so good, and they wouldn't really want to trust them. So, but the Caline does work, as does our land use regression model, as do the monitoring stations. And I want to emphasize that, because the monitoring stations really are an integrated measure of the industrial as well as the road pollution, as well as the port and any other pollution you can think of, right? So this background or local mixture actually still does predict these kind of outcomes, as well as when you're closer to sources. So we are really seeing these outcomes linked to different ways of measuring similar but different things.
Okay. Anyone else want to comment on that? No? Okay, Doug. Let's see. Hard to read the first two words. Here.
I'm not sure I can answer it then.
Yeah. Something before science established whether or not the motor vehicle pollution for ultrafines and PAHs is directly responsible for medical conditions with which it appears to be correlated in recent studies. I think it says, how long would you say it will be before the science is strong enough to have that medical link? And I think maybe someone else will want to comment on that.
Yeah, I think a lot of us could. Well, so I think that there are a couple of problems. The science with ultrafines is a long ways behind the science with PM 2.5, for example. And I was just saying there are no chronic studies. Our study is a chronic study, but it's cross-sectional. And usually, in terms of policy, you need longitudinal studies. So if we're the first cross-sectional chronic study, then there's a ways to go, for one thing. And then the other thing I would point out, which I was thinking about during the earlier discussion, that sort of runs through all of us, is sorting out what are the causal pollutants in this mix is really a problem. We have built UFP models or PNC models, but we haven't built models for the other pollutants and then tested them together, and that would be a whole nother large effort to get to that point. So I think there's a lot to be done. I wouldn't put a number of years, I wouldn't put some estimate of years, but I think we've got a ways to go. And I think some of my community partners, because of that, have sort of backtracked to talk about proximity as the main way they're framing their approach to policy and practice, because it's hard to argue just the ultrafine point scientifically and strongly enough.
Okay,
right
so
now.
Doug, you responded to the ultrafine question. I'm going to actually turn to Ricky a minute and say, what about the medical or the health effects and PAHs?
How do we ascribe effects, proportionate effects to each of the individual PAHs?
Well, no, I think just PAHs in total. Are they directly responsible for medical, I hate the term medical really, health
Right.
conditions correlated?
Yeah.
Do we have enough data to say that that's pretty clear, that there are adverse effects of PAH exposure?
Well, we certainly know that the PAH are carcinogens, and many, many studies have shown that, and both in the workplace and excuse me, and in other settings. I think that we do see neurodevelopmental effects replicated across several studies, and that's certainly important, several longitudinal studies. And we have to remember that we aren't just, having to depend on epidemiology, that we also are backed up by experimental studies which can mimic the human, to the degree possible, the human exposure, and actually look at mechanisms in much greater detail. And when we see consistency between experimental studies and epidemiologic studies, I think that's extremely valuable. That's the system that IARC and other agencies use.
Okay, thank you. Actually, we could kind of extend that question to ask about some of the other neurodevelopmental effects that Beata's seeing, not necessarily being linked to PAHs, but being linked to near roadway. Beata, do you want to comment on that?
So luckily, autism is rare. So you need a very large population in order to study this. And what Ricky is studying is very intense, is very much at the personal level of the child, measuring these developmental milestones and cognition. What we do is we just get a diagnosis. And when you get a diagnosis of autism, it's a really severe diagnosis. If you want to see the effect of a relatively low-level exposure, which air pollution luckily is in LA now, you need a large sample size, and that's what we had. So we were able to actually show that there still is an effect on this very severe diagnosis from a relatively low exposure, which I think is important. But this is all pregnancy-related exposures, actually, and we only have a 9 months, maybe only a 3 months window where it's really, really bad. So coming back to the timing aspect, we kind of know which time window to look at. It's a short time window, we can estimate it well. When we're talking about longer-term effects, we have to do this now into the future longitudinally for chronic outcomes, and I work at the elderly level with Parkinson's. You have to estimate exposures over a lifetime, and that's when it gets really hairy. And we have just started to do that actually in Denmark, where we have a traffic-related pollution model for all of Denmark that starts in 1972. We used it on our Parkinson's study, and guess what? We are seeing effects. So if you model long-term exposure well, you can actually also see long-term effects.
So I guess one thing, your studies with autism spectrum disorders are based on really ecological design and where people live, but there's also the studies that have just come out based on the CHARGE study, which is being done at UC Davis and UCLA, and Heather Volk has shown an association there with comparing children with autism spectrum disorder compared to typically developing children, and clearly seen an association with where their mother lived when she was pregnant near freeways.
Yeah, that's no different from what we did. She had an address and she plugged in a model.
Well, but she has individual
Yeah,
people, that she's
yeah, we
followed.
too.
Okay.
Every person was an individual.
So these are different populations, which I think is important,
Yes.
and then there's also another
Yes.
study. So I think that the strength of the evidence based on epidemiological observations, at least related
It's
to near
strengthened,
roadway
yes.
and autism spectrum disorders, are growing. So Jim, could the positive results seen in China with the strong pollution controls be replicable in U.S. cities?
Well, yeah, well, that's a good question. I think clearly the levels are high, and in the studies that I presented today, the change, just that change, the 30% reduction, that change is probably higher than, several times higher than the pollution levels we have. But I think the study was designed so we really study the mechanisms, how those pollution is affecting people. As I mentioned, those are young people, 20 to 27 years old, medical students, and there's no, they're healthy, there's no any pre-existing disease conditions. But just that, with those changes of pollution, we can see that changes of pollution is associated with changes on those biomarkers that are related to one of those pathways that I presented. So that means, this is quite strong, and it's clearly that those PM, and today I show PM 2.5 at UFP, they're not correlated, and they act with a different lag sort of timing scale. Those are all short term. We only talk about 7 days after exposure. But still, that kind of thing really support the biology. We always think maybe we have some animal models to do in the laboratory, but this is in the humans, we show this. Now, the question is how those kind of short-term findings, short-term exposure findings translate to the long-term exposure that Doug was trying to do. And also, I think fundamentally the mechanism was there. This is typical toxicology. You start with a higher pollution, higher dose, but then you try to see what could happen in the low dose. But directly how to apply that to US, I think probably just to do the risk assessment. So the estimate, it's probably hard to do, but in terms of how it works, I think that's the part we can translate,
Right.
if you will.
Okay, let's take a question from the floor.
After,
Is that the camera?
after carrying other people's questions around, I finally came up with a couple of my own that I'd like to ask. And I think this first one goes to you, Dr. Brugge, and that is, you and others on the panel have studied the effects of near roadway pollution on these health effects. Have you at all looked at what kind of roadway traffic has been going on during the hours when you've seen the effects, as to whether that is heavy truck traffic or light vehicle traffic, or gridlocked commuter traffic, just sort of sitting in traffic jams and generating a lot of idling pollution? Has there been any effort to tie the type of traffic to the timing of the health effects?
Yeah, if you go to our website, we've published a lot on that already on the environmental science side, because the data is collected and we could analyze that in advance of looking at health associations and in advance of even analyzing the blood samples. But so I would say a couple of things that are important take-homes from that, and that's not my side of the project, but I'll impinge on theirs since I'm the only one here. One thing is that the traffic volume is not the main or the only thing driving the air pollution levels. The meteorology is very, very important. And one of the ways that you can see this really clearly is on the same day, say it's a winter day, a cold winter day, in the morning commute there will be very high PNC levels near the highway. In the afternoon commute it will be much lower, and the traffic volumes are very similar at those two times. So that's one thing, just to give you an idea that it's not all about traffic volume. Secondly, in our study area, truck traffic is not a major factor, and I know in the morning this came up. I've forgotten the numbers, but I think it's 95, 97% automobile traffic on our highways. So if people are thinking it's all about diesel, all about truck traffic, it's not. And if you have enough cars, then you get a lot of this pollution also, although a single diesel truck will produce a lot more than a single car. And then I think one of the other lessons that I alluded to is it's not just the highways, it's also the local traffic and the major roadways. And I think others have sort of reached that conclusion as well, probably before us, and we had to relearn the lessons for whatever. We're just dense or whatever. But anyway, but I think a lot of people have come to the same conclusion that you have to look at the major intersections, major roadways, things like that as well.
So in a sense, we're going to go back at some point to talk about the sources and what we can do to control it. It's not going to be just the major highways, for example. It's going to be a multitude of things that may need controls. It's not just diesel trucks.
Yeah, that would be where I'm at this point on this, right?
Okay, question 2?
Yeah, question 2, have commuters ever been looked at as a potential source of study subjects, and particularly women who are pregnant and commuting and looking at the tailpipe in front of them for half an hour a day like I do? I wonder whether that's a candidate group that has been looked at.
Yeah, those are the in-vehicle exposures, and there are actually quite a number of them in California, I'm sure somewhere else too. And what my colleagues who do these measurements found is that the car is not a space vehicle. It has inputs from the air. So the highest CO and probably also ultrafine particle load you get is actually in the middle of our roadways. So when you're sitting in traffic, there was a school bus completely outfitted with every air pollution measurement device you can that went through LA, sampling from the air, showing exactly that. But also the car exhaust, and in this case it was a regular school bus, was actually worse than anything that happened otherwise in the roadway because it came directly into the cabin. Yes, and since Californians are sitting in cars more than they are actually spending time outside, that's a substantial proportion of your exposure. It's probably, they calculated up to 25% of your daily exposure.
There was a study that the intramural program of EPA did a number of years ago where they looked at state police, and this was in North Carolina, so the traffic wasn't quite as terrible, but they basically measured what they were being exposed to. At the time, I think it was 2.5 and 10. I don't think it was doing ultrafines, and saw changes in heart rate variability, which is a measure of a cardiovascular impact on the patrolman based upon how long they were sitting in traffic or how long they were basically on shift.
Another population that's been studied quite often are traffic workers, traffic police, and toll booth workers and groups like that.
Yeah,
I just wanted to add one of the things we did that was an inadvertent study. To get to one of our study areas, we had to go through the tunnel in Boston, and so the environmental science folks did a paper on the levels inside the tunnel, and that is really instructive. Those are the highest levels you're going to find anywhere is inside a road traffic tunnel. So very, very high.
Go ahead.
Hi, Henry Anderson from Wisconsin. I'm very interested in the biomarkers of effect that we're putting a great deal of effort into trying to assign exposures and then by hour. I mean, what you've been doing there is a massive amount of work to do every day and every hour. Of course, the integration of that is if we had a good biomarker of exposure, fine particulates, we really don't have that for measurement in the urine or something. Then we have the biomarkers of effect, which two of you had looked at, and part of the challenge of public health is how do we convince clinicians that they ought to pay attention to this. And there's a lot of movement now on the cardiovascular aging population side to look at these kind of upstream precursor measures of stress or inflammation, and they're fed into the cardiovascular risks now with on and off use of C-reactive protein and some of these others. Kind of a long comment here, but the question to you is, do you see any of these being specific to air pollution versus overall better measures than we have clinically? Should we be able to go to the physicians and say, if you test for this, you ought to build that into your model of how you get into prediction and prevention kind of things?
Jim?
So, okay, I think probably what I would answer with the sort of the biomarker for exposure and a biomarker for effects. Yeah. If two of them can be specific to a particular pollutant or stress, that would be ideal. But first about exposure, I think Dr. Pereira's study with that PAH DNA adduct, I think it's very, I think it's, if we can find that kind of markers for many of the other pollutants, that would be great. I mean, the only things sometimes we have a problem is because there is other sources non-specific. But I think definitely there is room to go there. And in many of population studies, it's much easier to get a urine sample or some other form of a biological specimens than try to carry a pump for a day or 2 or weeks. I mean, if we find that, I think it will be ideal. I think we still have room to go. My laboratory has been working on that. We try to see the protein adducts of nitro PAHs, that kind of thing. And I think it's in the earlier stage, but will be compound specific. So that would be great. And then the question about exposure, health effects biomarkers. I think, the London study that I presented, that was a collaboration between me and an asthma physician who actually, the clinics are using FeNO for asthma exacerbation. And they would try to say, what about the exhaled breath contents at the EBC? There's that time, there was a great hope for this condensate to serve as biomarkers for lots of the clinical relevant disease exacerbation, that sort of thing. I think was not as smooth as what originally thought. I think because there's some technological challenges, but the CRP you mentioned, that's actually chronic disease marker, but the thing is clinically they have a benchmark, way going down to way lower level. But we're studying different populations, young people, whether we have in this study, we just show that pollution will change at that levels, but clinical benchmark, I think if we work on also this coagulation markers, I did discuss with some cardiologists, very earlier stage, maybe more patient-based studies, if we measure this as CD62P, if that really have a high correlation with a heart attack, that's okay, I think, but it's very early. I think it takes some time to get there.
Oh, thank you.
Right.
Beata?
Can I ask
Doug, and then
a follow-up
Ricky.
question of you, Jim? Have you tried, we're starting to consider looking at metabolome or something along those lines? I'm wondering because you have these kinds of instruments and you do this. What is your thought about that approach?
That would,
A
I
lot
think
of
that's
graduate
very, I
students.
think maybe Dr. Burbank will chime in. I have had a high hope, and the challenge is so great and require lots of funding, and you're limited to do what you can do. But in theory, with that breath, the same thing. If we have those mass spectrometry, if we really analyze those volatile compounds come out your breath, and then the profiling them and indicating a disease exacerbation or some exposure, that'd be wonderful. I think those are, in concept, it's great. I think maybe someday we'll get there, but it's really, really challenging.
So there is some work being done on the metabolome and associated, for example, with cardiovascular health and so on. So that is being done more in the medicine field, but it could certainly be linked. I did want to make a comment, and then I know Beata wants to make a comment, that when we talk about exposure monitors, at least personal exposure monitors, they're now being developed that are the size of a deck of cards instead of a backpack, which can monitor not 1 or 2 analytes, but can measure a large number of VOCs, as well as PM 10 and 2.5. I'm not sure whether they're doing ultrafines yet. I'm just not positive, but there are a number under development. Some are actually in field trials as well. Beata?
I just wanted to point out that biomarkers are no different from these other models, the environmental models we're using. They have to be defined in space and time. So if you get one urine sample, is that representative of your all life exposure? Probably not. Maybe not even of the last months. Maybe it's just a marker of the last hour, what you were exposed to. So we have to kind of put that into this dimensional space. Yes, it is a marker, but what is it a marker for? Most of the time markers are sensitive but not specific, and then they have to be placed in time and space. And being a physician so that's on exposure marker. On the biomarker for the outcome for the disease, yes, there is cardiovascular disease, and we know a lot about risk factors for cardiovascular disease, blood pressure, et cetera, that we can measure. But there are lots of diseases where we have nothing. We don't have much for cancer. We don't have much for Parkinson's, for Alzheimer's. There are no biomarkers, and we've been trying for many, many years to get them. So there is not really a very specific way of approaching that, but we have been lucky in the cardiovascular field.
I think we should mention that biomarkers are also not only time and space as far as the exposure, but in terms of the response, because there are acute effects, and then there are long-term effects, and you may have very different markers to be reflective of those. Ricky, you wanted to say something?
Well, just the point that we are getting much better at measuring what's now being called the exposome in a rather grandiose way to sort of match the genome. And those methods, you touched on them, Jim, methods to look at an array of protein adducts, different, not just one chemical, but many, and those methods exist. I think we also know how to measure the internal dose of compound and metabolites quite well, and those have been the biomarkers of exposure that are most commonly used. As Beata says, you have to understand what the duration of the period of exposure you're actually measuring. But in cases of chronic exposure, those can be very useful because those exposures are pretty constant. And I like the molecular epidemiology approach, which is we fill in the blanks between exposure and clinical disease by building in these biomarkers of internal dose, effective dose, and then preclinical effects. And the ENO, exhaled nitric oxide, the breath condensate markers that you and others and people in my center are using are very useful as sort of preclinical indicators that can be linked back to the exposure and then forward to the actual clinical outcome. So we're getting better at this forensic science.
So I'm going to go back to
Just one quick.
Andy. You're going to another quick one.
One quick. Do you gather occupational history? You talked about the commuting and things like that there can be some pretty high exposures.
Yeah, we asked people's occupation, and then we went through, it was more of a qualitative coding process to code their level of exposure based on the occupation that they reported that they worked in. Yes.
Okay, so I've heard a lot of information about that there are some pretty clear health effects associated with different kinds of air pollution. I would say so far we can't say that or definitively separate. Some of the ultrafine effects may be stronger for certain things. They may not be as strong as some of the 2.5 is for something else. And we've heard from this morning that maybe we should pay attention at times to the coarse particles as well. But I wanted to go to Ricky because there are a couple questions for you. One I think you've already answered about the adverse health effects that are associated with the PAH exposure that is associated not only from traffic pollution in your study, but also from indoor pollution and so on. But the question is that's being asked, which I think is a good one, is ambient concentrations of PAHs in your New York City study, are they changing over time? And how does this affect your results?
I did show a slide which was based on the prenatal monitoring data from the personal air monitors. Women were enrolled between 1998 and 2006, sort of cyclically, and we are now continuing to enroll. We had a gap of several years, and now we've begun to enroll younger children. So we're going to have a pretty complete record from 98 all the way as long as we're able to continue. And what I showed was the trend, the downward trend in the PAHs. Not all of them. Pyrene actually did not obey this nice decreasing trend, which the 8 PAH that we looked at in the air, in our air monitoring, did and showed. And so we do have good news in that respect, and we attribute that, at least in part, to the efforts that have been made by the MTA, the Metropolitan Transit Authority, to replace the dirty diesel buses with cleaner fuel, to reduce, to clean up the fuel in trucks and buses, and cars getting cleaner over time as well. I mean, we also have exposure from residential fuel oil burning. There's not much coal burning in the immediate area. So those are the primary sources, and most of the pollution does come, it's generated by vehicles in our particular setting. So we do have some nice positive news there, but we'll see how it continues to play out.
So this is kind of a follow-up, although it was directed to you, Beata, but I think it follows on what you just said, Ricky, that PAHs seem to have various sources. How confident can we be in available health effects or attributing health effects to traffic pollution?
I didn't understand that.
Okay, so the question I think is we know that PAHs come from sources other than traffic pollution. So how confident are we that some of the health effects we're seeing, say in your studies or anyone's studies, are associated with traffic pollution and not, say, stationary sources or some other combustion source?
Right. You can never be certain, right? But what we see is the same signal over and over again when we use different ways to measure this. So clearly the monitoring station dependent exposure assessment approach tells you something about the collective, which is industry, which is port, which is traffic, all together. And we saw effects when we use those measurements. And then we see effects when we look at our land use regression model that predicts traffic. And it was built to predict traffic, and we see that same signal. And we use the CalLine model that EPA in California produced, and we again see a signal. So when we start putting all these different exposure assessments together and we get signals no matter what we do, then we know there's something there in all of these sources that causes disease. And we all agree that, you know, it doesn't have to be just one source. It is whatever the mixture, toxic mixture is that's in that source.
But as far as traffic pollution goes, I would say that there are a large number of studies now showing adverse health effects associated with increased traffic, and it's been shown in multiple cities, multiple states, multiple countries around the world. It's not just LA, for example, or Boston.
Yeah,
right?
LA is where I play.
Right.
So, but yes, there are tons of studies in Europe, and one of them I just conducted myself in Denmark that shows it too.
Right.
Shows it for cancer and for Parkinson's.
Right. So, Doug?
I think the reason this question has some resonance, I agree with everything you're saying, but the reason it has some resonance in terms of policy and doing something about it is then what is it specifically that you're going to address, and what are you going to do, and if you're able to do something that reduces one pollutant but not another, is that the right one to reduce? And something we have not talked about here today, which I think is on the leading edge of that needs to be resolved a little more, although there is some work on it, is the issue of sound, because we have traffic noise exposure, which is largely along these same gradients that the air pollutants are on. And I think there is some evidence that these are separate effects and the work that's been done so far, but I think further separating those is something that needs to be done as well. But I think when you try and go and do something about it, that's where you want to know that you're doing the right thing and that it's going to have the desired outcome, and that's where it may be a little bit tricky.
I also like to say that probably not every pollutant will cause every disease. That would be highly unlikely. So when we talk about carcinogens, and hence a pyrene and PAHs are certified carcinogens, we have used them in workplace environments, and IARC agrees that, you know, they are carcinogens in humans. It's just a question of dose. And so when you get enough of the dose, then you see a cancer effect. But how low can you go in order to not see it anymore? Then you have neurotoxins, and those may be different agents, maybe sometimes similar agents. And then you have agents that work on the cardiovascular system. So going agent by agent and disease by disease is not very public health relevant. We have to find a way to capture the mixture and to improve health overall instead of picking between diseases.
So I think I still have a number of questions, but we're running towards the end of this session. I think this is a good one that came actually from one of our someone on the webinar, but says, based on research showing negative health impacts from PAHs and ultrafines, what can be done to try to limit exposure?
To try to what?
Limit exposure. Who wants to?
We're starting to look at that, and we haven't come up with our final answers yet. But there is a good list of tactics from the sort of the design phase. I know this morning people were talking about the design of vehicles and the fuel types, and we're not addressing that. We're talking more about if you're building residences in a high traffic area, what might you do to make that more protective? And some of the things that we're looking at are vegetative barriers, sound walls, which we're talking about this morning and are potentially problematic, and so I think we're concerned about the potential problems there. Better indoor filtration and ventilation systems. In particular, Southern California, we look at you guys as you're the leaders, and we're like, can we get another node started on the East Coast? But where in Southern California, they have put filtration in the schools that are near the highways, and they did pilot projects, and they showed that they could reduce the pollution, and then they implemented that, as I understand, in 40 schools.
And what they found
Yep.
was fewer asthma exacerbations occurring during school.
Okay, I didn't know that.
So that we haven't talked much about asthma, but that's
Right.
clear.
So I think that there are a whole range of tactics, and there's a longer list than that. You can put decking over a highway if it's depressed so that you cover it up completely. There's a lot of tactics that could be employed, and the question is, which are most effective, which can you convince either a municipality or a developer to agree to, and things like that. And then we also need evidence, as you're saying, Linda, that once you do them, that they have some positive benefit as well.
So, yes, Ricky, and then I think.
So you described some mitigation strategies. I was thinking more about, let's go to the source and see, and obviously more efficient engines. I think the mileage efficiency, what is it called, energy efficiency standards for automobiles have been very important. Cleaner fuels, better designs, alternative energy sources. And we've been talking about this at lunch, a couple of us. If we are thinking of, electric engines, we have to think about automobiles. We have to think about what source is being used to provide that electricity, and we have to go back to the, in other words, cradle to grave kind of idea. I'm not sure that's a cheery image, but the whole life cycle.
Life cycle works.
What?
Life cycle is a
much
little
better
more
than-
pleasant.
Much better. But we have to start thinking holistically, and the elephant in the room, big elephant out there, is climate change. So anything we do to reduce our dependence on sources of CO2 would be very important.
So I think with that, I want to thank the panel for a very instructive afternoon, and turn it back to Jim, to Tim.
Well, we have a few minutes before we agreed to come to to a halt. The reason I asked Boyden to join me, this is all a project of the Energy Future Coalition, which is this group set up by the UN Foundation, and Boyden and John Podesta and I were the founders of that, and Boyden has been one of the key people on the steering committee. We've been thinking about this aromatics issue for a long time for a variety of different reasons, some of which have been talked today. So I said we're hoping to have a follow-up session on the 20th of May. I think that's the date, John. Is that right? 20th of May. And we thought this might be a useful time to bring up what are some of the policy questions and therefore suggestions that have emerged from the discussion today, or are part of your thinking and part of the reasons that you came today. So it'd be useful to begin to help us to flesh out what does that agenda for 20 May look like. Boyden, I don't know if you'd like to start on this, if you'd like to begin us, and I'm going to ask Reed Detchen, who's the runs the Energy Future Coalition, for his thoughts while you are thinking about it, and then just open it right up, please.
Well, it seemed to me that one thing that came through loud and clear was roadway. We don't know exactly what in the roadway, but it looks like the roadway is a major source for all of this, and I was surprised by the Tufts research, no trucks basically involved. I'm not surprised by it, but I think that's noteworthy. So what can you do about that? What can you do? And Ricky was sort of taking words out of my mouth as I was thinking about what to look at. I think what you look at is in addition to cleaner vehicles, to me, more fuel competition, more diversity of fuels. We've already seen that on the utility side, where if you're a utility, you can pick among a range of cleaner and some very clean fuels, whether it's low sulfur coal to natural gas to nuclear to biomass to wind to solar to water. Why shouldn't a car company or a car consumer have a choice of cleaner fuels, more competition? Most of the competition that's out there, potential competition, whether it's natural gas or methanol or ethanol alcohols or hydrogen or electric, they're all cleaner. So, one question might be, one issue might be, all right, what do we do to encourage these cleaner competitors to get more into the game?
Reed,
Well, Dr. Pereira and Boyden got us started. Is this on? I think that what came through to me was that you have to think about this as a system. And Dr. Brugge at the end was talking, in his slide, was suggesting things like foliage and things you can do in individual places, which I think is important, but we need to think about this systematically if this is a problem of roadway exposure, obviously across the country and not just in the U.S. So I think that we have focused for a long time on controls on the automobile itself, and those are to be desired, but I think that what we hear from the automakers is that they're going to have to make changes in their vehicles to comply with these new higher efficiency standards under Tier 3. And that if the fuel is not cleaned up, and we heard that one time earlier today, if the fuel is not cleaned up, that could actually lead to higher particulate pollution. So I think that a new set of attention to the fuel question is where so far we have done the least.
Great. Other thoughts? Please come over and grab the microphone. Yeah.
So something we didn't hear, we heard fuel mentioned, and we've heard road dust and things like that. I guess I just want to read a title from recent ES&T, environmental science.
Make sure you speak right into the microphone.
So there's
Speak into the mic because we can't hear you.
Speak right into the mic, will you?
Okay. one of the things that I think where we're needing a little bit more research is to kind of understand how we've talked about multiple types of pollutants here. We've talked about PAHs, we've talked about ultrafines, we've talked about SOA, we've talked about PM 2.5. And they all kind of are linked together out there and in kind of the engine. So one of the things that we in EPA have worked on for a long time is trying to figure out what's driving emissions. And there's been some attempt to characterize these ultrafines and what they're made of. And one thing that has come out quite a bit is that there's a significant contribution of lube oil. So there have been studies that have melted particles out of a diesel engine, and it looks like lube oil. There's particles that come out of a gasoline engine, and it looks like lube oil. And there's a study that was published a couple months ago from California researchers. It's a tunnel study, and they were pretty much saying lube oil is dominating the organic emissions, this sticky stuff. You know, that being said, there's obviously an interaction here. PAHs form when you burn stuff, and so it seems as though one line of research that's needed is to kind of understand how the burning of stuff, fuels or whatever it is, interacts with the oil to get out the tailpipe. And it seems to me like lube oil is a carrier for things that are generated in the cylinder, and that has implications for how we control it. So that would be a question that I would have is how much of what we're doing kind of controlling both the fuel side, the oil side, and all the other things.
Well, my reaction is really the same as what I said earlier. How do you induce cleaner things to compete better in the marketplace? Maybe that doesn't work at all. Maybe that's not, maybe it's an economic question. Someone has to sit there and look at the costs. But I think, and it may be more complicated, it may not be a simple answer, but I do think it's a question that ought to be asked, why the electricity consumer has so much choice, but an automobile consumer has basically no choice. And the competition in the utility side is driving, appears to me, I mean, Tim's spent probably more time on this than I, but it appears to me that the model, that the real world is threatening the classic utility regulation model, and there's competition from distributed power, from solar panels, from all kinds of different directions that are driving the normal, regular 100-year-old utility crazy. And the result is, I think, a cleaner mix of sources of combustion. So that's sort of my operating principle.
We're in the left.
Yeah, Lynn Goldman, George Washington University. See, I think that actually that the individual does have some choices. I think that individuals can choose, for example, hybrid vehicles, which cut back on the amount of fuel that you burn, and if you burn less fuel, you actually emit fewer particulates. I think also that there is now a choice, although it hasn't been driven very well either by the market or by regulatory forces, for electric vehicles. And there is something inherently inefficient about each one of us, if you may, generating energy in our own little internal combustion engine in our car. I think there's a limit to how cleanly that can be done compared to generating electricity in larger plants and that electricity being distributed for use in cars. And that is an alternative. It's not one that is widely in the market, but it could be. And I think that that is something that seriously needs to be contemplated, because I fear that trying to go down the path of making cars cleaner and cleaner and cleaner, while it's a good thing, and certainly I've supported it in a lot of aspects of my life, from working for the state of California to being at EPA, there's an inherent limit to what can be done as long as you're burning liquid fuels. And with the expansion of the use of automobiles globally, that's going to be one that's hard to catch up to. And in fact, I think we're already seeing that, because the growth of vehicle miles driven in the U.S. even has made it difficult to make all the gains that we should have gotten. And the other thing that strikes me, to just mention this as well, is many years after the first PM research agenda, that was what, 1999 or something like that, the amount that we still don't know about PMs, and that it's still so difficult to attribute sources when we can measure exposures, we can measure marks of exposures in people, but it's very difficult to do source attribution. And so I think we have to be very careful about how we make inferences about the health burdens of PM exposure, attributing them to cars as compared to other sources like fuel burning at ports and other modes of transport.
If I can just mention something here, this sort of, I don't know whether it's true or not, but I'm told that the car companies are worried or concerned or aware that the younger generation, today's teens, don't really look to drive as much as we all did or do. And that one of the reasons, and so public transit obviously, or maybe limiting driving in interstate, like there's parts of London where you can't go unless you were in a diesel bus, I guess. One of the reasons, this may sound very silly, but one of the reasons why teens don't like to drive so much, they can't text. They just can't text. I'm sorry, I just couldn't resist.
Steve Ennergreen again. I just wanted to confirm what Mr. Dutchin was saying, that the auto industry is really asking a vehicle technology and fuel chemistry need to occur for future fuels. I would also say that, as the EPA commented to motor oil, that a lot of the PAHs found in used motor oil is really from the oil dilution from your high distillate aromatic. So when we have, primarily PAHs form UFPs and aromatics form the PAHs. And aromatics themselves, like benzene and toluene or methylbenzene, has been highly tested for their own toxicities. 5% toluene is the national average for the U.S. consumer's gasoline today. So, the concern here is, I think you have to, at this next meeting, focus on the fuel itself, because we just submitted a paper with the autos that even how we blend test fuels is very important to getting to the bottom of the concerns around UFPs and PAH formation. So I would like to agree that May 20th needs to, get the autos input here on both vehicles and new fuels as we move forward.
Great, thank you.
I think one of the things that were brought up at the first panel with Dr. Nell, and even this second panel, is there seems to be a certain level of agreement that these high levels of PHAs are found predominantly around roadways, which kind of, it kind of eliminates trees, volcanoes, and forest fires as the primary thing that they're looking at here, and they are finding a number of, health issues and things like this that are related. I guess my question to all of the panelists and everybody that were here, and I see Dr. Nell standing by the other mic, maybe he could even speak to that, is if there was a way to get a 50% reduction of PHAs coming out the tailpipe of automobiles, would that be considered statistically significant, or that type of reduction? Would that help? Would that make a difference?
So looking at a lot of the questions, so I guess I'm now summarizing because some of the opinions have been expressed, but if you look at it from a multi-technology perspective, fossil fuel efficiency is clearly a factor that comes into play here, and cleaner fuels clearly come into play. Then if you get into hybrid, then the important considerations as far as I'm concerned is number one is look at the amount of energy that it is going to take to operate that vehicle. And with newer materials coming in now from material science, nanotechnology that can provide vehicles that are much lighter because they're made out of composites, provide one huge advantage, providing part of the moving vehicle's energy from the sun by, a simple technology that drives the electronics in the car is another component. If you now move into the area of lubrication, where we've heard earlier on, new materials like graphene coming out as new lubricants that is extremely efficient can contribute significantly also to energy reduction and therefore fuel use. And then I think that if you look for a little bit further down the line, if you look past batteries, there are new technologies now that are coming forth. For instance, if you go and look at Google, Google has a boombox standing at the front of its building providing 50% of its energy, and it does so by a new system of panels that help to transduce based on material science and different dye compositions energy, and they've combined that with gas and therefore combustible materials in order to make an integrated energy source, which have taken their need of fossil fuel products down by, I think, something like 20%. So an integration of all of these developments, I think, will go a long way to decreasing the energy needs. I can also talk about the new materials that become available for friction on tires, where things like carbon nanotubes that can contribute to the formation of new car tires and products like that could play a huge role. And then ultimately, I think that from a standpoint of energy use, the introduction of more and more new technologies where we make use of the old technology but decrease its contribution to the output probably is also a way to address some of the problems that we deal with.
Great, thank you. John?
I just want to follow up with that comment about some of the this new technologies that designed to reduce the emissions of particle mass. Earlier today I presented Oxford Street study that was done in earlier to 2003 to 2005. So we measured ultrafine particles in the street, and now we're doing a follow-up study there with a different type of patients and more biomarkers, that sort of thing. But what we find is that the PM 2.5 mass levels were lower than before. There is a reason, because London, this bus was retrofact, whatever they call it, they put in the particle trap or things like that. So the PM mass level indeed came down as expected, but ultrafine particle number concentration actually increased as that technology. And also we published a paper, my group published a paper this year or last year in the Environmental Science Technology. This is about the nano particle-based fuel catalyst, which are widely used in Europe. We actually bought it in UK. You can buy from any petrol station, and you just put that into the diesel engine, and that will bring down PM 2.5 emissions, because also bring down the CO2 emissions because increase the fuel efficiency. So we did a test with the tested diesel engine, and we find that ultrafine particle number concentration actually increased while the other things decreased. So all those sort of, now if we think ultrafine particles is important in terms of health effects, I think we have to consider those technologies that you try to do one thing, but probably you forgot that the other unexpected negative side shows up. So I think all come to this question about really what's the more kind of integrated consideration in terms of how to really improve reduce the health impact from technology.
Good, thank you, Jim, and thank you for being with us. Let me come over here and then come back to you, Bob.
Okay, I'm Katie Walker, Health Effects Institute, and I wanted to just toss out some things and provide some resources that might be helpful as you go forward in thinking about your policy workshop. One of the things that we, as in a year of scarce research dollars, we think about is making sure we make full use of the kinds of information that's already out there. And there is a lot of research that has been done sort of around this area. And just speaking from HEI's standpoint in terms of reviews and trying to collect it all and make sense of it, we have a traffic report that came out about in 2010. And one of the messages out of that, which is no surprise to the researchers here, is that it is really difficult to attribute to any one marker the kinds of effects that we see in health effects that we see in these proximity to traffic studies. Although I think we're seeing new research that's showing us more information. But in particular, we did an extensive review of the ultrafine literature, asking many of the same questions that you asked today that we published in January of last year. Which really pointed to some of the challenges in understanding exposures to and effects of ultrafine particles. We didn't focus particularly on PAHs because there just aren't many studies where PAHs and ultrafines have been studied together. So these are, we have a number of research recommendations there going forward that I think have been echoed here today. And finally, I mean, we just finished up a big study on a national particle component toxicity study, which really looked at how do we begin to tease apart and can we come up with better ways of identifying what it is in the ambient air pollution mixture that's really causing these effects, because I think like you, we really wanted to understand what those are. And significant challenges, even with a very well-studied pollutant like PM 2.5. And so I think there are lessons to learn about that as you think about what would it take to construct a research program going forward that would answer a specific question about, ultrafines in particular, or aromatics in particular, or PAHs in particular. It's a major investment, and I do think that we ought to sort of look to National Academy of Sciences work on sciences and decisions and decision sciences in general, and begin to think about what it takes to answer questions, what the value of information is that you are likely to get from the research that you'd like to have, and really take those into account in building an effective and cost-effective research program.
Great, thank you. 2 minor final comments, Bob and Bede, and then we're done.
I don't want to have the last word, Tim, but it's Bob Musil, formerly
you
with
don't.
physician.
Right behind you is the last word.
Oh, good. Bob Musil, formerly with Physicians for Social Responsibility, now with the Rachel Carson Council. As we move toward a policy session on May 20th, I want to recall that, of course, we need policymakers, policies, scientific data, but I think also we need general support from the public and understanding. So as I was looking at all of the various displays, obviously the roadways pop up. It seems to me that we need to link these constantly, this is my bias, to public health. As Ricky Pereira was talking about, we need to get to the root of this and to get to prevention. I think we could label roadways as rivers of disease. We don't tolerate polluted rivers anymore. We have the Clean Water Act. When John Snow went after the causes of cholera and the famous Broad Street Pump effect, once we knew where the cholera was coming from, we took action. We know that this is coming from highways, and we need to stress, I think, that for the public, that it causes all of the various diseases. I understand the complexities, that we can't exactly pin it down, but most people think air pollution is just an irritant. It's bad, it's smoggy today, and maybe it causes some mild problems. But so I hope we will find ways to communicate rivers of death and disease, focus the problem around public health, and then link that to policy.
Great, thank you.
Just one little add-on, because I think it got kind of lost in our discussion as the panel. ultrafine particles were so fascinating as for me, because I realized how actually the fetus could get harmed, because ultrafines are nanoparticles, meaning they can go through cell walls into the cell. They can go into these mitochondria inside the cell. They can cross the blood-brain barrier. They can get to the heart. They can get to just about every place in our body. It's not like the larger particles that really lodge in the lung, and that's where they stay, and they might cause inflammation there and maybe even a systemic inflammation, but they don't go anywhere else. And these nanoparticles then take all sorts of things with them and deposit it in these cells, in these organs. That's why I, as a physician, find them so fascinating and so terrible to think about. And we shouldn't forget that. And what Ricky is doing with the PAH adducts is actually showing that they can get into certain systems, and we even see them on our DNA, and they do bad things on our DNA. So we don't want those things attached to our DNA. And I think that should be motivation enough to clean them up.
Great, thank you. Linda, any final words that you would like to put in before we close this down?
First of all, I think we've had some really interesting discussion. I think we've had some interesting ideas. I was just jotting down a couple of kind of maybe provocative ideas. One is we're trying to figure out what compound or what component of the complex mix is associated with a health effect. But different components are going to cause different health effects, and they're going to cause different effects in different people based upon genetic susceptibility, co-exposures, etc. The reality is what we have to deal with is the mix. And I think at times we spend a lot of time trying to deconstruct it, and I understand that that is important for can we make it less problematic, but we have a history of going to alternatives without fully examining their effects. And I'd hate to move to something that turns out to be worse. So that's just kind of a caveat of something I wanted to think about. And the other thing is really a reference back to what Ricky ended her question with before, which is we've got to think about life cycles. It's not just how the fuel is used. So, for example, there was a little discussion this morning, we never really got back to it, about how much, for example, aromatics were present in different kind of fuel blends. If you use biofuels, if you increase the amount of biofuel in the total mix, did you have lower aromatics and so on? But then we have to remember that it's not just what comes directly out of, or what's in the fuel, it's what comes out of the tailpipe and then goes through atmospheric transport and alterations and so on before it actually comes down and not only makes contact directly by, say, inhalation, but actually gets transported to different locations on the globe and then may enter our food chain and so on. So I think Lynn Goldman's kind of comments were actually important, is that we can think about what individuals can do, but it's really much more important for us to begin to think from a public health point of view what society can do to lead to positive changes. And some of that may actually be things that we're not terribly excited about as a society, but we may have to begin to engage in issues of more mass transit kinds of things where we would be generating less emissions per person moved, et cetera. So those were just some thoughts.
Great. Well, thank you very much to everybody. Thank you. I think we have to remember the context in which we're having this discussion today, which is a context of a world that's getting, that is rapidly changing, that where climate change is the ultimate, say, existential challenge that we all face, and everything that we do, I would think in some way or another has to contribute to trying to figure out how we avert, that massive crisis. We're also looking at a context in which the World Health Organization, I don't think this was mentioned earlier, reported there were 7 million deaths last year from air pollution, premature deaths from air pollution, which is a very, very significant number. The world is looking at people in Beijing struggling to breathe, and we're in a situation which Paris just shut down 2 weeks ago, along with 30 other French cities because of air pollution issues. And these are upon us, and I think that there is a real public support. There is going to be significant public support for activities when people understand that their health is getting directly impacted by what's happening. It's not just looking at the brown cloud in Denver, which I grew up with. It is understanding that there are very, very significant health problems in this broader context. And in saying that, that's not a therefore for the 20th of May, but it certainly provides us, it seems to me, with some sense of urgency. And my own is that, to try to think about this, future research is important, but all of that's going to take a long period of time. And there has to be a menu that's more immediate that we can look at. I think we want to make sure that we have talked with the people in the transportation business, with the auto companies, and really pin down what in fact is the case related to fuels and efficient automobiles and the lighter materials, and what difference does that make. I think we really want to know that for sure, and maybe we can the next time around, or at some point have there's some of those companies are very, very progressive about how they think, and that kind of knowledge, it seems to me, ought to be spread more broadly. Second, I'm struck by the fact that nobody from the oil companies came today. We invited them, none of them came. I mean, they are the predominant sort of fuel of choice for everything that we're talking about, whether it's rivers of death or their freeways or whatever we want to call them. I mean, it is the fuels that we are talking about, and how can we, if possible, clean up those fuels? What are the alternatives to those fuels? What are they thinking about? These are not dumb companies. There's some very, very smart and sophisticated individuals, and it seems to me asking them a number of these questions is also an important marker to put down. We talk about biomarkers. I think there are some information markers that would be useful for us, and maybe they won't share them, but certainly, they're very big and very important, and obviously going to be part of the solution. Anyway, we've been in the Energy Future Coalition after this issue for some time. This has been very helpful today. Wonderful to hear from the people who are right on the edge of the best research probably in the world that is going on in the university communities and the laboratories that we heard about today. And we want to again thank all of those researchers for being with us and for sharing their long-term commitments and their extraordinary technical capability. It was just phenomenal to listen to that, even if I didn't understand a good deal of it. Getting the flow of that was extremely important and very, very impressive. And finally, Linda, again, thank you, and thanks to NIEHS for your sponsorship. We want to thank the National Academy of Sciences for having us here, the Institute of Medicine, Harvey Feinberg, for being specifically our host today, and Boyden, thank you for, as always, your support and help, and John for putting all of this together. You were the horse that made it all happen. So to everybody, thank you very much for coming, and we will be back in touch about future plans and agenda and where we go from here. Thank you for coming. Thrilled.